Today I wanted to spend a little time talking about the chin. It's one of the most important facial features as far as bringing harmony to the face. A lot of people will know the term such as a weak chin or a recessive chin, which means the chin is pushed back. And the overall effect of that is that it makes people look heavier in the neck, it makes people look older, and also it brings imbalance to the profile so that it'll make the nose appear bigger or the rest of the features to appear like they're out of balance with the face. So when we're looking at the chin, it's a little different between the sexes as well, as far as male and female. With men, we want a slightly stronger chin, and in women, slightly more feminine. It doesn't have to be perfectly aligned in women because it can start to look masculine. So when we're looking at the chin balance and the side profile, we want that chin to be lined up with the lower lip. And when we have that, we have an almost perfect profile in the chin. So in men, when they have a weak chin, one of the things we notice a lot is that they'll grow a beard, they'll grow scruff, they'll grow a goatee, something to cover that weak chin. And the reason they do that, again, is that it makes them look older or appear like they're heavier, they've gained weight. So the illusion when you have the chin is that the neckline is extended, looking younger. People will say you've lost weight, something about you is different. They won't necessarily know exactly what it is, but the overall effect of strengthening the jawline and the chin is that you will appear more attractive, younger, and like you lost weight. So if you have a weak chin, how do you go about treating it? How can you make it stronger? There's a couple different options. A lot of people start with just simple facial fillers. They'll do injections to augment the chin to kind of get a taste for what a chin implant might do for them. So they go ahead and give it a shot, but then they have to give it another shot and another shot. So after a while, they start having the fillers in the chin. It starts to add up. It becomes expensive because most of the facial fillers aren't permanent, so they have to keep repeating those shots. But I do think it's a good way to start out evaluating it, seeing if you like the look on your face. Does it balance your profile? Do you like the overall look or feel of having the chin being a little bit stronger? Now, the advantages of the chin implant over the fillers is that the chin implant is permanent. So once you put it in, you don't have to replace it. You don't have to keep redoing this procedure. It's a one-time surgery. And there's two different ways that you put the implant in. One way is a small incision under the chin to insert it up and put it onto the bone here. The second way is to do it from inside the mouth with dissolvable sutures. I personally prefer to do it the second way through the mouth, so there's no scar on the face, nobody will know what you did, and it's essentially scarless. And the way that it sits on your face is that the chin implant looks sort of like a little boomerang. And when it goes in, it sits on your chin just like this. And these little wings on the end help to balance along the jawline and fill in any gaps that are here near the pre-jowl. So the whole implant sits on the chin. Once it's in, like I said, does not need to be replaced. It doesn't move. It heals exceptionally fast. And I do this in a lot of different sorts of patients. Athletes, boxers, fighters, they do not move once they're in. Secondly, it's not a painful surgery because we're not actually putting screws into the bone or doing anything with the bone itself. We're simply laying the implant onto the bone. It heals very fast and is essentially almost painless. One other thing that I think is really important about a chin implant surgery versus just fillers, which only augment the chin a little bit, is that when you put this chin implant in, it actually helps release some of the frowny muscles that are in the lower face. So the point I'm trying to make is that when you're putting in a chin implant, it does a lot of different things for the face. Number one is it's going to correct the jawline. It's going to make you look more youthful. It's going to make you look more attractive, and it's going to make you look like you lost weight. And then, in addition, it will correct your expression. So if you feel that you look a little bit upset or pouty, it will correct that expression and just give you a much more pleasant expression. So people will think you're more approachable. It's just an overall feeling that you look more attractive as well as expressionally more welcoming. So once we've inserted the chin implant into the mouth, since the way I do it is dissolvable stitches inside the mouth, the recovery is actually very quick. Some patients feel that they're talking a little bit tight, that the chin feels a little bit tight, but they don't really complain about pain. As far as getting back to regular diet, eating regular foods, it can be within a day or two. This is not a surgery that should knock you down for a long time. And then additionally, because there isn't a lot of bruising, there isn't a huge amount of swelling, your appearance looks maybe somewhat like you had a minor dental procedure done. This is not something that's going to cause a great deal of bruising and swelling, so that you can get back to your normal life fairly quickly. Since I held this blue one up to show people what an actual chin implant looks like, this is actually just a sizer. What the actual implant looks like is a clear silicone implant like this, and it has a little blue marker in the middle here, which shows us exactly where the midline and where it goes once it's in the mouth. Secondly, the actual newer implants have what's on the back, almost like little suction cups. And what those do is when you put this in, it grabs right onto the chin, which makes sure that it never moves again. It's permanent, you don't have to replace it ever again, and it heals exceptionally fast. One of the great things about a chin implant surgery is that it's essentially undetectable if you put them in from inside the mouth. So I get a lot of questions about what celebrities might have had this procedure or who else has done this surgery, and the answer is it's really hard to tell because it's undetectable. Similarly, if you have the procedure yourself, it's also going to be undetectable. So it's one of the surgeries that I really enjoy because when you do it, it's a really fast healing and it's undetectable and it's going to do pretty much everything you want it to do. One of the things I get a lot of as well is I don't want a chin that looks like Jay Leno or a chin that's really strong and long. And those are patients that actually don't have chin implants. They're just patients that have a naturally long chin. And that's important as well as putting in this implant, because in a case like Jay Leno or somebody with a long chin this way, the implant would literally need to be put in this way. And we don't do that, we only put it in this way. And that's also important because the real power of this procedure is in your profile. It's going to be lengthening the neckline. In the front view, the main effect is again to reduce that pouty look or make your expression a little more pleasant, but it's not going to be something that's going to be extremely noticeable in the front view as compared to your profile. Another question I get a lot of is if you have a cleft in your chin, will it be corrected by placing a chin implant? And the answer is this will not affect the cleft in the chin. When you put this in, it's going to go behind the cleft and push it forward. So in the case that you want to keep your cleft, that's great. In the case that you may want to remove the cleft or soften it, what I typically do is put a little bit of fat grafting into that cleft to correct that and make a nice smooth chin profile. Patients also ask me if they can combine a chin implant surgery with other procedures. The answer, of course, is yes. The most common procedure to combine with a chin implant is a rhinoplasty. And the reason is they both affect the harmony and balance of the face together, called the profile. So if the nose is strong and the chin is weak, it's going to be much worse. So when you want to bring that nose in and you want to bring the chin out as well, because what can happen is the doctor can over shorten the nose to adjust for the small chin, where in reality you want to balance those features together. So I think it's critically important when looking at things such as rhinoplasty and chin that we do them together in order to get a harmony that's very balanced and beautiful. If you have any more questions about chin implants, please leave them in the comments below.